Catherine, and I'm a doctor in natural medicine and a researcher in the field of kidney health. And today I want to share with you the biggest hack, the #1 most effective trick to get the job done. And the goal here is to get your kidney health back naturally. Guys, this can be done. I've seen patients that were already in talks for starting dialysis actually get better, get a stable kidney function, sometimes even significant improvements. Because while people suffering from CKD are supposed to lose their kidney function week after week, today's science proves that this is not necessarily true. Even if you are in stage 4 or even 5, in some cases, you do still have the chance to improve. This can really happen. But how can you achieve that, you may ask? Well, science says that the only way to achieve the goal of a better GFR is to treat the causes and complications of kidney disease naturally, without relying too much on medications. This is what science tells us about people who improve with kidney disease. But how can we do that? How can we keep all of our health markers under control without having to take too many medications? I know! You will need a competent naturopath, someone who is really specialized in kidney health related issues and that can help you creating a personalized strategy. But wait, I'm a naturopath and I can help you personalize your own treatment. This is why today we will pretend that me and you are having a consultation here in my office, and I will do my best to offer you a personalized solution. How, you may ask? By focusing on what is causing all of your problems. Because guys, the trick here is finding what works for you. Seriously, chronic kidney disease is an umbrella term, alright? There are many ways in which this disease could present and many comorbidities it can come with. This is why you need a personalized approach. You need to find what works for you. Many people have diabetes or swelling or inflammatory conditions, nephritis or maybe uric acid problems, and each of these conditions must be taken care of. So for each one of these issues, we will see what really works. I'll start with diabetes because I believe a lot of you are interested in that, but you can also use the navigation bar and that description to navigate to the part you are more interested in. So diabetes. This is the most common cause of kidney disease and it must be approached in several ways if your goal is to beat kidney disease. You don't want to only rely on medications in order to take care of this dangerous disease. You also want to follow the right lifestyle and diet. Remember that diabetes is caused by visceral fat, the fat that accumulates around your organs, preventing your pancreas from making enough insulin and preventing the other cells in your body from using this insulin. Most medications cannot take care of that. Well, maybe Ozempic can if you can afford that. But what's even better is following the right diet and exercising as well. And there are also some natural supplements that can help with diabetes. First thing I would consider is a combination of berberine and banaba extract. Now, this is something I would consider essential for anyone with diabetes, not taking metformin. In fact, the effect of berberine is comparable to that of metformin in terms of blood sugar reduction, but with less side effects. And the interesting thing about berberine is the way it works. Berberine suppresses glucose production in the body, all while enhancing insulin sensitivity. What this means is that it will also make you lose weight, so it directly treats the cause of diabetes and not just the symptoms. Now, berberine can be made even more potent with banaba extract. Many of the berberine supplements you find on the market contain this extract, and for a very good reason. This combination, banaba and berberine, was tested against a placebo on 148 diabetes patients. After just 3 months, 34.3% of patients taking Banaba and berberine returned to a normal glycemic status. Yes, they were able to send diabetes into remission with this combination. The most common dose used in medical literature for berberine is 500 milligrams 3 times per day before meals for a total of 1500 milligrams per day. Now, something else I would also recommend for diabetes is chromium. Chromium is an essential trace element we can get from supplements and also in small doses from foods. What this molecule does in the body is stabilizing and reducing blood sugar levels by improving insulin sensitivity. And since it works in a different way from metformin, even those taking the medication should consider it. And keep in mind that chromium will decrease your blood sugar levels, alright? Now, these are the 3 things on my short list for diabetes. They are safe and everyone with diabetes should consider taking them. Okay guys, up next, a condition that's not a cause of CKD but a pretty serious complication. Many people have trouble dealing with this, but there are supplements that can help. Let's talk about swelling. Swelling is a common issue for people with CKD because it is caused by fluid and sodium retention. So the first thing we should focus on here is getting more fluids and less sodium. Remember that when I talk about avoiding sodium, I'm talking about processed foods. I believe that most of you guys have already forgotten that the salt shaker even exists. But you must also be careful with processed foods, takeaway, restaurants, and all that. Now, here's a recommendation for fighting swelling that only a naturopath can give you. This is something called horsetail or Equisetum arbenzi. This is a plant with diuretic properties so potent that a 2014 study found that the extract of this plant had the same diuretic effects as prescription medications, but with fewer side effects. Yes, this is incredibly powerful and will help with swelling, but it can have some side effects. For example, it may deplete vitamin B1 and it can also increase potassium levels. This is something even certain prescription diuretics do, by the way. Now, one thing that helps with swelling, and that's absolutely side effects free, is taking magnesium and vitamin B6. In people with kidney disease, vitamin B6, especially when combined with magnesium, is linked to increased urine production. And this is exactly what we want in order to fight swelling. If you have kidney disease, get prescribed a renal multivitamin containing vitamin B6. There are some good habits I would always recommend as well. First of all, if the swelling is in your legs, rest with your legs raised when you can. Even just half an hour of that can help, especially if you do it in the afternoon. This would also help with nocturia, and also consider using compression stockings. But the best thing you can do to fight swelling is regular light exercising. Regular exercise is a great way to catch 2 birds with 1 stone. Getting your heart rate up will help circulate whatever fluid you have built up, and it will also directly help with controlling fluid retention. Sweating more means that some of that extra fluid and sodium will leave your body without the help of your kidneys. So absolutely exercise regularly, and also consider doing hot baths or saunas regularly to sweat more. Up next, something I don't talk enough about on the channel. Many of you are asking me about this issue. So let's see what actually works for glomerulonephritis, also known as nephritis, and also nephrotic syndrome and lupus nephritis. These I will group as inflammatory conditions. These are all conditions that come with a huge inflammatory component, and that's what causes most of the damage they do in the kidneys. Now guys, as you probably already know, in case you are battling with one of these conditions, the goal of the medical treatment is to reduce the inflammation, and you may also want to consider some supplements that are going to help with that. First of all, supplement vitamin D. This is a must for anyone with kidney disease, but for those with inflammatory conditions in particular, because it fights the inflammation in the kidneys. Same for vitamin B6, B12, and folate. These vitamins can reduce levels of homocysteine and C-reactive protein, markers of inflammation. Also, one more thing that's extremely effective for inflammatory conditions is taking omega-3 fatty acids, but in high doses. As we can see from my slide here, omega-3 supplementation is recommended for anyone basically. I personally take a low dose just to protect my heart and my kidneys. But if you can have an inflammatory condition, you may want to take much more than the minimum dose. In fact, high-dose omega-3s have been used to improve the outcome of patients with IgA nephropathy, a form of autoimmune kidney disease. However, while low doses are perfectly safe, if you want to take anything more than 2,000 milligrams a day of combined EPA and DHA, consult your doctor. High doses may decrease blood coagulation and potentially make any anticoagulant more potent. Now, one last thing I would recommend here is a curcumin plus piperine supplement. This is a powerful anti-inflammatory that can also be considered for chronic forms of pain. So consider taking what we have just seen in case you have any of these inflammatory and autoimmune conditions. Okay guys, I have some more interesting ways to treat the conditions related to CKD to show you. Before we move on, a question that I bet many of you have in mind right now. Do we really have to take all these supplements? It is really necessary to add all of these pills and powders every day? No, you don't need all the supplements I'm showing you. This is my short list for what really works with the most common causes and complications of CKD, alright? These are some of the things that work and that are known in medical literature to support the medications that are regularly prescribed. And in some cases, to help you decrease the need for medications. The idea here is to decrease the side effects and, most importantly, the toxicity the most common medications have on the kidneys. This is why you should consider the supplements that can help you with the most serious conditions you may have. Now guys, it's very important to keep in mind that you should never start several supplements at once. When you decide which one is best for you, start only that. Then monitor your levels in your health journal and also see how your GFR at your next checkup goes. You want to see an improvement here, obviously. And if that happens, congratulations. Not only you, well, improved your kidney function, you also know what supplement is giving you this improvement. Wouldn't that be amazing? But keep in mind that this all works in the context of a good renal diet with tons of fruit and veggies and very little protein, and with a lifestyle that supports kidney health. That said, let's move on and see what helps with high uric acid levels. If you've ever heard of uric acid, it was probably in relation to two unpleasant conditions: gout and kidney stones. Uric acid is considered the culprit of both these conditions. But what causes high uric acid levels in people with kidney disease is something called purines. Purines are found in foods, alright? This is why, when it comes to decreasing uric acid levels, the first step is always to avoid foods that are high in purines, also known as trigger foods. These include meat, especially organ and red meat, seafood, especially if rich in mercury, but also sugary foods, and beer and alcohol in general. Always avoid these food items. I mean, even if you don't have high uric acid levels. Now, if you do have high uric acid levels, consider getting a prescription for allopurinol from your doctor if you aren't already taking it. But how do we lower uric acid levels naturally? First of all, with water. Always stay hydrated. Drink at regular intervals during the day. This really works for anything related to kidney disease because the kidneys need lots of water to get rid of toxins, sodium, sugar, extra fluids, and uric acid as well. Now, one vitamin that directly detoxes uric acid is vitamin C. Studies are linking higher vitamin C intake to lower risk of gout. Always supplement vitamin C if you have kidney disease in general, but in low dose, 100 milligrams a day of ascorbic acid max. Someone with gout may want to take more than 100 milligrams a day, but don't do that without consulting your doctor, as high doses of vitamin C may have side effects. Now guys, what some people don't know about gout is that the pain is not caused by the uric crystals themselves, but by the body attacking them. It's the inflammation this response causes that creates pain. This is why, when it comes to fighting the symptoms of gout, natural supplements with anti-inflammatory properties work great. We have just seen what anti-inflammatory supplements are best for kidney health in the chapter about inflammatory conditions. Vitamin D, vitamins of the B group, omega-3s, and curcumin are really recommended also with gout. So this is what really works for uric acid in kidney disease. Up next, let's talk about the safest and most effective natural options for one of the most underrated issues for people with kidney disease. I'm talking about high cholesterol levels. Now, while I understand why many people tend to underestimate the danger of high cholesterol levels, I want to point out that this is a serious issue, right? And you should pay attention to your cholesterol levels, especially but not just if you have diabetes, because you see, diabetes is known to damage the lining of the arteries, making it more likely for cholesterol to stick to them. This is a serious problem. It doesn't just raise your cholesterol even further, it will also increase the risk for heart disease, stroke, and other cardiovascular issues. This is why, in case of diabetes, some doctors are starting to recommend to keep LDL or bad cholesterol below 70 milligrams per DL instead of the 100 milligrams per DL the general population is recommended. So never underestimate the risk of high cholesterol. But what can you do to fight dyslipidemia naturally? Well, first step, as always, is taking care of lifestyle and diet. Reaching and maintaining a healthy weight through diet and exercising works a million times better than any medication. But there are also some supplements that can help. The very first thing I would recommend someone with too high cholesterol levels and CKD is a fiber supplement. Acacia fiber is just one of the options, and while it's probably one of the most powerful supplements for kidney health, there are other fiber supplements that can also help. My second choice here will be psyllium husk, which is a lot cheaper and easier to find than acacia fiber, and it also really helps with cholesterol levels. Keep in mind that fiber supplements are something I always recommend even without cholesterol issues. The other, more specific supplement I would recommend for cholesterol is phytosterols, also known as plant sterols and stanols. These are plant-based compounds, natural substances that compete and block cholesterol absorption in the intestine during food digestion. You may have heard about them with the brand name Cholestuff, but there are other brands that sell the same high-quality supplement at a lower price. These supplements can really help with cholesterol. 2 grams of phytosterols per day can produce a reduction of 8 to 10% in bad cholesterol levels, as we can see. Now, the other issue with high cholesterol is the statin you may be taking. These medications are known to cause a significant problem, which is lowering CoQ10 in the body. This is part of the reason why statins cause muscle pains in many people, but it's also linked to kidney damage. So always supplement CoQ10 if you are taking statins. Now guys, at this point you may ask, Catherine, have you really forgot about high blood pressure? No guys, I haven't, but since many of you are asking me to make a video just about high blood pressure, well, I will do what you ask for, and I'm also going to talk about the supplements in that video. So stay tuned, subscribe if you haven't, and set the notification bell to all if you want to watch my next video about high blood pressure, which is coming next Sunday. Or you can watch my recent video about natural ways to flush out excess toxins. It's up here and also down in the description. And this is all for today. Thank you for watching. God bless you all. Bye!